How to use guide to choosing the right health plan properly. Beginner mistakes that cost you. Choosing the right health plan is more than just picking the cheapest option. Most people get this wrong, but the right strategy can save you hundreds or even thousands annually while ensuring you're fully covered. The first mistake beginners make is focusing solely on monthly premiums. Lower premiums often come with higher deductibles, co-pays, and out-of-pocket costs. The surprising truth is that the cheapest plan might end up costing you more when you need care. Always consider total annual costs, not just the monthly payment. Another common error is ignoring coverage details. Some plans may exclude essential services like mental health support, prescription drugs, or maternity care. Carefully reviewing benefits ensures you won't face unexpected bills. Many people forget to check provider networks. Even if the plan looks great on paper, it won't help if your preferred doctors or hospitals aren't included. Always verify network coverage before enrolling. A surprising mistake is overlooking preventive care. Some plans charge extra for screenings or vaccinations, while others include them at no cost. Prioritize plans with strong preventive coverage to avoid larger expenses later. Finally, beginners often skip comparing multiple plans. Even small differences in deductibles, co-pays, or network size can significantly affect your experience and costs. Use multiple comparison tools and read the fine print carefully. To properly use a guide to choosing the right health plan, evaluate total costs, review benefits thoroughly, check provider networks, prioritize preventive care, and compare multiple options. Avoiding these beginner mistakes ensures you select a plan that provides strong coverage and real savings.